Yakima Valley Community College Radiologic Sciences Program presents Radiographic Positioning. Humerus.
Hello. Our room is set up for a humerus exam today, and that will be the focus of this lesson. Our patient is Jacqueline. She's in a sweatshirt right now, but she's actually in a patient gown. You want to remove the bra strap if it's close to the humeral head. The sweatshirt I think you'll be able to see, but just pretend she is in a gown. Room setup is we're going to choose the wall bucky, a vertical wall bucky. It's much more convenient for the patient. They can walk in. They can be sitting on a stool if they have a problem standing up. If you were to lie a patient down, they have to use their shoulder muscles to get down, and it actually can be more painful for the patient. However, there are times that a patient may be faint and are not able to stand up. So you would need to do these in a recumbent position, perhaps even on the stretcher itself. The centering, the part film reference points, the PC information, it will all be the same whether the patient is vertical or recumbent. We're choosing to demonstrate it again in an erect position because most of the time that's the way you're going to choose to do it. I've got 40 inches SID tube to the wall bucky here. I'm going to use a 14 by 17 cassette in the wall bucky. I want to ask the patient where their injury site is. So can you show me where you're hurting, where your injury was?
Right here.
She's actually real close to the elbow, so I would call that a distal humeral focus. And so I would put the ID to the top in that perspective. If she were to tell me, or I could see bruising or bleeding with the injury closer to the humeral head, I would reverse the ID blocker, just reverse the cassette. This would be for a proximal focus. Okay? But again, we're going to do a distal today. So ID to the top. And Jacqueline, can you just step away for a second? You can see that I've got the crosshair aligned so the tube is transversely centered. I've collimated somewhat because this is the 14 by 17 film area here. The patient's arm will actually dictate just exactly how far you do collimate. So that will be like one of the last steps that we focus on. So we can let our patient come back here. Your department may have a tripod type apparatus that a lead shield hangs from. In this case, we're protecting our female's reproductive organs with actually a Velcro strap lead apron. And I have a right marker ready to place when it's appropriate. The centering reference for a humerus is the film's edge is 2 inches above the humeral head, or 2 inches above the shoulder. If you just think of shoulder, you've got to think humeral head. Again, you might recall that some people's shoulders slope, so you wouldn't want to go 2 inches from this shoulder reference, 2 inches from the head, the femoral head region. You want to include both joints. So I'm going to tentatively set my film up, film's edge 2 inches above her shoulder. Okay. Then I like to see where her elbow is. I'm just going to raise the shirt up for now. Can you see, I don't know if the camera, if you can see the crease here of her elbow. And I'm going to adjust my tube. And then what I like to look at is here's her elbow, there's her humeral head. And in Jacqueline's case, the center crosshair is actually dividing the length of the arm in half. So her humerus is perfectly centered. The bottom's film's edge will then be approximately 2 inches below the elbow, and I'm quite satisfied with the centering of the humerus. Somebody with a very short humerus, you would have the film's edge probably 3 inches above the humeral head. Somebody with a long humerus, you may have to take 2 pictures, clearing the body part by 2 inches that you're of most interest in this case the humeral head, And if you're not going to include the elbow, you may need to take an additional image in order to include that joint. But the average woman's arm should easily fit on a 14 by 17 film. Most men's arm will fit on a 14 by 17 film. You can center the humerus, but make sure you've got 2 inches clearance from the humeral head and 2 inches clearance from the elbow. Once I set my film height, remember I readjusted my tube so everything is centered. Now I must worry about my patient's side-to-side centering. I'm going to focus on this crosshair right here coming down the arm. If you were to look and analyze the placement of this crosshair, it's actually coming right down the glenoid fossa, and it comes in between the body and the humerus. Your focus is the humerus, and it is not centered. So we need to have our patient take a baby step away from me. Very good. And now here's the glenoid fossa and the lateral aspect of the body. We'll take her shirt back down again. The lateral aspect of the body. And this crosshair should be coming halfway between those 2 points. And I think the cameraman can tell that. Okay? So I like that centering. I'm making sure the arm is coming down straight, so there's going to be no elongation or foreshortening. And I'm now going to palpate gently. I'm not squeezing. I'm going to feel for the humeral epicondyles. Her epicondyles are at an angle here, so that is not a true AP position. We need to turn your arm in a little bit. Okay. So I got the humerus into an AP position by taking the epicondyles, barely palpating those, and getting those parallel to the film. And then I made sure the palm of her hand was thumb out. That puts the humerus in an AP position as well as the forearm in an AP position. Collimation, now I can look. I've got quite a bit of light over here. Quite a bit of light here. And how much light do I have on the other side of the glenoid fossa? Quite a bit of light there. So her arm is going to allow me to collimate side to side a little tighter. Then I will move my right marker in a ways, so it's included. The camera can focus on that for a minute. And you will all have arrows or internal-external markers. And this is an external rotation. The arm is in an AP position. That's an external rotation. So I'm going to use that arrow to point outwards, meaning external. In an AP position, the greater tuberosity will be in profile on the humeral head region. And the epicondyles will be parallel on the distal end with the proximal radius and ulna slightly superimposed, if you have done a good job of positioning this patient. Again, find your humeral head and your elbow. The film's edge should be 2 inches above the humeral head. You should have 2 inches of clearance below the elbow. And basically, the crosshair, what you're shooting for, is this crosshair here to be mid-shaft. Side to side, find the glenoid fossa, the lateral portion of the humerus, and this crosshair will come right down the center there. That has the humerus balanced there, right down the center of the film. Double check the epicondyles, make sure they're parallel, the humeral epicondyles, and make sure the palm is turned out for the proximal radius and ulna to be slightly superimposed. The size of the arm will dictate the size of collimation, and you use a marker to a corner here. R marker with an external for this particular setup. You have your patient hold their breath, and you make your exposure. Have them breathe, but do not move. Change cassettes. You're going to do an internal now, so I'm reversing the arrow, pointing inward. And Now, ma'am, I'd like you to turn your arm in for me. That's good. And then you feel for the epicondyles. And what is 90 degrees opposite from being parallel? It's perpendicular. So I'm feeling the epicondyles to make sure they're going to be superimposed one on top of the other in a perpendicular relationship to the film. And then the thumb is turned in. If you've done a good job of positioning the lateral, the epicondyles of the humerus will be superimposed, and the greater tuberosity on the humeral head will be superimposed. You'll have a nice round head rather than the greater tuberosity being in profile. The size of the height of the film did not change, but side to side, take a quick look. Glenoid fossa, lateral aspect, and this crosshair should be coming straight down the arm. Sometimes the arm comes out like that. You don't want that. You don't want to force it too close to the body, but more in a natural position. Make sure your collimation is still clearing the arm, and with the arm coming parallel to the plane of the film, not extending backwards or extending forward. And again, anytime you do an erect position, the patient's feet should be separated. That way they will have a better stable base and will tend to move less on you. They'll be able to hold that position better. Or you could do this in a seated position. And that's a humerus exam.